Good evening. On behalf of the Access Community Health Center staff, I'd like to welcome you to our annual celebration of service. We are so thankful for your support over the past year. Nhớ rằng sự kiện là dấu hơn lựa Access Community Health Centers. Cứ trong xe tại có cái bilu công trong celebration of service. Bị thấu cái châu cái chế bắt sang cái bê lưu xong tala no.
This support has allowed us to safely provide care during the pandemic to those most in need.
Normally, we would celebrate together at the Monona Terrace, but we're happy to gather virtually tonight. Normalmente celebraríamos juntos en Monona Terrace, pero nos complace de reunirnos virtualmente esta noche.
We hope that you will enjoy our celebration and learn more about the people that we serve and the work that we accomplish every day. Thank you for joining us tonight.
Hi, everyone. I'm Janan Yasseri-Mo, and I'm so grateful to be here with you tonight at this year's celebration of service. Of course, normally we would all gather together at Monona Terrace to honor the work of Access Community Health Centers and the partnerships that make that work possible. Tonight, we gather virtually to reflect on a year of unprecedented change and uncertainty. This past year has seen our community confront both the realities of systemic racism and the devastating impact of the COVID-19 pandemic. It has been a time of enormous hardship for so many of the people we serve at Access. Not only are many still at risk to contract the virus, but many are also facing unemployment, food insecurity, and the loss of health insurance coverage. Access is now caring for more people who are unemployed, anxious about their future, and concerned about their continued access to health care. In this time of real change, however, there has been one real constant: Access's ongoing commitment to create a healthier and more equitable community for all. Tonight, we want to have a conversation about this commitment, our commitment to make a real difference in the lives of the people in our community who need us the most. We'll talk about the impact that Access makes every day, the needs that have yet to be met, and the work yet to come. We will also celebrate tonight and thank all of you who helped make this work possible. I'd like to give special thanks to all the sponsors of tonight's event. We're grateful for our benefactor sponsors, the Group Health Cooperative of South Central Wisconsin, UW Health, Unity Point Health Meritor, and Quartz. And our leader sponsors, Epic, SSM Health, and Exact Sciences, as well as each and every sponsor of tonight's event. You'll see a list of all the generous organizations who have supported this celebration during the program and in our chat tonight. Thank you to all of you. If you've been to the celebration of service before, you know how much flowers are part of the event. As you can see from this lovely bouquet behind me, we wanted to continue that tradition tonight. Access has partnered with Daffodil Parker for flowers at our celebration of service for many years. Usually, at the end of the event, you would be encouraged to take home one of the table bouquets, and many of you used it as an opportunity to donate to Access. Tonight, Access and Daffodil Parker are partnering to offer one lucky attendee a year of flowers, where each month for the next year, the winner will receive a bouquet of beautiful flowers delivered to their home in thanks for your support of Access. All of you who registered for tonight are eligible, and at the end of the evening, we will announce the winner in the chat. Once again, thank you for your presence at tonight's event and for your generous support of our work at Access. Your support has made a significant impact on the health and the lives of our patients during such an uncertain time, and it gives hope to so many. Thanks again for coming tonight. Enjoy the program.
Buenas noches. I'm Brenda Gonzalez, and I'm proud to serve as president of the Access Board of Directors. Thank you for joining us tonight as we celebrate our commitment to Access and their commitment to our entire community. And that's what I would like to talk about tonight, the important and unique role Access plays in our community. Of course, it is important to recognize that our one community is made up of many different and diverse communities that can be identified through geography or neighborhood, race or immigration status, poverty or wealth. While our communities may coexist, there are too few opportunities for all of us to come together in real and meaningful ways. For almost 40 years, Access has worked diligently to build community by removing barriers, nurturing relationships, and expanding opportunities. This year, more than ever before, Access has been at the heart of our community. The systemic racism experienced by so many of our patients has come into focus this year like never before. The pandemic has affected our patients, especially those of color, in many different ways. We have now been living with COVID-19 for more than a year. Black and Indigenous people and all people of color have suffered the worst of the virus. The pandemic's impact in the United States has exposed long-standing inequities by race, ethnicity, and income, and COVID-19 cases, deaths were disproportionately higher in communities with larger Black and Latinx populations. Diverse populations are also more affected by lasting consequences of the pandemic, like the loss of jobs, mental health concerns, and limited access to healthcare. Personally, I have a strong passion and commitment to connect and assist those in our community that have been impacted the most. As an immigrant myself, involved with other organizations dedicated to serving the needs of the Latinx community, I know Access has a unique ability to provide services to those in need in a safe and culturally diverse environment. When I joined Access Board, I saw the opportunity to be part of a board inclusive, community-wide effort that tackles some of our greatest community challenges. Now, 5 years later, I see what a real difference Access makes in the lives of our patients. Receiving care in our own languages, having diverse staff that mirrors our friends and families, and having clinics located close to our home, these unique aspects of our care mean so much to our community, to all communities. As board president, the remarkable work that Access has done and continues to do, especially during this time of great uncertainty, is what energizes and inspires me and the entire board. In a time of great need, Access continues to innovate and expand to meet the immediate needs of those we served. Tonight, our conversation is about community. As a community, we know we're only as healthy as our most vulnerable people. If our neighbors do not have access to the healthcare and the resources they need to stay healthy and support their families, especially during this time of the pandemic, that affects all of us. Your support helps Access fulfill our mission to provide comprehensive medical, dental, and behavioral health care to those who need it the most. I hope you continue to support Access in the coming months as we work together to ensure all individuals and families can receive the high quality, compassionate care that makes a real difference both in their lives and in the life of our community. Gracias.
Hello, I'm Julia Weiser, a family physician at our William T. Evu Clinic since 2017. I'm so grateful for the opportunity to share some reflections on the work we've done at Access during the past year. In thinking about the challenges we faced in the pandemic, it is clear that while the logistics of doing our job at Access have changed, our dedication to our mission has not. We are still providing our community with the best medical and dental care possible, with the focus on helping those with the greatest need and the fewest resources. One of the greatest privileges of being a family doctor is forming relationships with patients and becoming a part of their stories. In the last year, I've witnessed examples of incredible resiliency, strength, and ingenuity which have inspired me to continue this challenging and rewarding work alongside my teammates at Access. It's a privilege to share some of these stories. I remember a particularly brave young woman whom I first met in our respiratory clinic with her infant son. They both needed COVID testing. Her husband was intubated in the hospital because of a severe COVID infection, and both mom and baby were showing milder symptoms. But this woman told me that her sore throat and fevers were the least of her worries. She was isolated from all her normal support networks. Her partner was in the hospital, her parents lived in another country, and her friends and neighbors couldn't provide the help she needed because of quarantine. In the midst of all that, she was understandably struggling to keep up with breastfeeding, and at her appointment with me, she found out that her son had stopped gaining weight since his last well-child check. The burden of her hardships felt so heavy, but fortunately, I worked with a team of people who I knew could help lighten her load. I referred her to our lactation team, who coached her on bolstering her milk supply and nursing her son through his congestive symptoms. I connected her to our behavioral health consultants, whose counseling services have been a lifeline to so many of our patients throughout the last year. These teams reached out to the patient over the phone to make sure she had the advice she needed to make it through the rest of her quarantine. A week later in clinic, I was able to reassure her that her son was back on his growth curve. In turn, she reassured me with the happy news that her partner had been successfully extubated and would go on to make a full recovery. During a pandemic that has robbed us of some of the most basic ways of supporting each other, it was gratifying to know that we had made a difference for this family at such a difficult time. Of course, we know that COVID hasn't changed only the lives of those who caught it. COVID impacted health in ways that we couldn't have predicted a year ago. I think about a different patient who shared his story with me in respiratory clinic. Prior to the pandemic, his diabetes was well controlled through healthy nutrition and routine exercise. But 6 months into the pandemic, that was no longer the case. He was worried about leaving his home, and he waited to reach out for care. So 9 months into the pandemic, his blood sugars were still rising steeply. One day, his glucometer couldn't register the reading because the blood sugar was so high. To make things scarier, he had a new cough and felt a little feverish. At that point, he finally decided to call our nursing team at Access. Under normal circumstances, his situation would have warranted a trip to the emergency room. The nurse he spoke to on the phone knew how high the stakes were when she heard his story. But when he also shared his fears about the potential financial burden of a trip to the hospital, she understood how important it was to come up with a plan that considered all of his needs, not just the medical facts. Instead of directing him to one of our overburdened ERs, she made him a same-day appointment at our respiratory clinic and arranged a ride for him. When he arrived, he met a team of people ready to help. Our registrar and medical assistant got him roomed immediately, reassuring him about our safety precautions. Our lab technician got rapid blood work, which did confirm that he needed to be started on insulin as soon as possible. Our community resource specialist helped him qualify for our pharmacy benefit so that the otherwise unaffordable insulin could go home with him that very same day. Our pharmacist helped train him on administering insulin injections, and our certified diabetes educator arranged follow-up telephone appointments to make sure that he would have the support he needed to stick with his new treatment plan in the days to come. As the physician, all I contributed that day was figuring out a starting dose of insulin and collecting a nasal swab. Through the bulk of his complex visit, my biggest role was marveling in gratitude and admiration for the amazing people I get to work with at Access. Their compassion and resourcefulness inspire me daily, and I'm grateful to be a part of their team. There's one more story I'd like to share, which comes from the very earliest days of the pandemic. For me, those chaotic weeks of March 2020 were the most intense and stressful stretch of my career so far. As a physician, I knew that I was supposed to be a source of knowledge, reassurance, and guidance, but as an individual, I felt just as confused and scared as everyone else. Nearly all our work in those early days of uncertainty was done over the phone. The pandemic hadn't hit Madison yet in terms of case numbers, but the economic and social fallout of COVID had already taken an early toll on our most vulnerable patient population. For 8 or more hours a day, I was fielding questions to which I didn't have great answers. Is it safe to keep going to my job in the warehouse? Where should I stay instead of a shelter? How can I take care of my family if I can't work from home and the kids can't go to school? But among these difficult, sometimes heart-wrenching questions, I also heard a different set of questions again and again. My patients asked me, "How are you doing, Dr. Weiser? How's clinic? Is everyone there okay? Are you guys safe?" It stopped me in my tracks every time. It reminded me that the most inspiring people I work with every day are my patients. It taught me that these relationships we formed go both ways. Our patients want to take care of us just as much as we want to take care of them. They are not simply recipients of the work we do, but active members of this dedicated team. Access patients are just as devoted as Access employees to our mission of improving the lives of everyone in our community. It has been the greatest joy and privilege in my life to be a part of their stories this past year, and I know they will be a part of my story in years to come. Thank you. And now I'd like to introduce my colleague, Dr. Kevin Fair, who will be having a conversation with his longtime patient, Annetta Price.
Well, this is the highlight of my week.
Oh, is it? I'm glad it
is.
is.
For sure, for sure.
So
Yeah,
are you
I've always,
busy?
I've really always enjoyed your positive energy. I don't know if I ever told you this, but one time I called you to discuss some lab results with you,
Yeah,
and you weren't home. So I got your voicemail,
right.
and you were singing on your voicemail.
Yeah, yeah,
And
yeah.
I wasn't having a particularly great day. So when I heard your voice and you were singing, it totally brightened my day.
I'm glad of that, Dr. Fair.
So I hung up and I called again.
No, you didn't.
I did. I think I called 3 times, just so you know.
I was wondering how long. I said, I think I've been with Dr. Fair either over 15 years or whatever.
That has been a long time.
I know, but I enjoy you being my doctor because you're so out front with me, and seem like we can just talk and agree, and you seem like you're just giving me what I need, because some doctors, they'll just tell you anything,
Yeah.
You already be nervous and fearful of things that be going on with you. But when you get a positive doctor that you enjoy, and I'm like, man, I'm so glad I got this doctor the first time and didn't have to go through different doctors and different doctors,
What brought you to Access? Why did you choose to come to Access as a clinic?
I don't, you know what? I was just looking for a clinic and I just decided to walk into the vestibule one day and I was asking them, do you guys take new patients or how does it work? They say, well, okay, what kind of doctor do you need? I say, well, I need a doctor for medical care, a physician, to do my yearly exams and everything. I said, I'm not a sickly person. I said, but I want to have all my T's crossed and my I's dotted.
That's great.
So that's how I got to go to Access Clinic. And when you decide that you was going to go to Park Street, and they asked me, well, are you going to get another doctor? I said, well, he went to Park Street? He said, yeah. I said, oh, no. I said, that's only 10 more minutes out of my way. I'm going to Park Street with him. So happened I ran into a good doctor.
Well, what do you like about Access? What has kept you there? As you're talking to friends?
I enjoy the staff that's there. I enjoy how they treat you there. And I enjoy, as making appointments and stuff. I never had a problem with making appointments with the doctors, with you or even with dentistry, when I was going to the dentist. I never had any problems, and the people, they were just welcoming, when you go there, it seemed like they always had time, to take care of your needs. And I enjoyed that, so I said, well, I guess this must be the place for me. So I just hung on in there.
Well, beyond being a patient, you also been on the patient advisory committee, which I really appreciate. That I think, you have such a positive voice and a great perspective to share with people. I wonder, why did you choose to do that? And what's that been like for you?
Well, Angela, she had started first. And then when Angela started first, I went to a meeting with her, and it was so interesting, because you get a chance to talk with the other patients that's been in and out the clinic and in and out of medical and in and out of dentistry, and we get a chance to express ourselves, among ourselves, and just tell the stories and stuff of the how the people treat us, and it was really nice. And I said, well, maybe I'll come back to another meeting, And then I got to the meetings and I seen that I was able to express myself, how I feel about going back and forth to the dentist and going back and forth to my medical doctor, And I really enjoyed it because you get a chance to share, your thoughts. It was really nice. I really enjoyed that, So that's one reason why I just kept on coming and kept on coming. I said, oh, okay, this is for me. I can express how I feel about the doctors and the good work that they're doing, and all the progress that the clinics and stuff have made since I've been coming there,
Mhm.
And I thought it was really nice,
Yeah. Were there any topics that have come up in those discussions that really resonated with you that you thought were really important and you were glad you had a chance to express your opinion?
The COVID, when that came up, I'm like, okay, now I'm not going to do anything with this COVID until I talk to my doctor.
Uh-huh.
And then when you brought it up, that was right on time because I've heard so much talk about it,
Yeah.
And then when you suggested, well, okay, now, Netta, when it's time for that, I want you to get that shot. I said, well, I trust Dr. Fair. If he said I'm going to be okay, I'm going to be okay. And I tell you, Dr. Fair, I had no problems with the first shot. I had no symptoms. I enjoyed myself. And then Saturday, I got my second shot. And oh my God, I was glad of that because they were talking about, okay, that second shot may do you a little different,
Mhm.
But I had no problem with that either. So I enjoyed doing that. And I said, well, thank the Lord that went through okay too.
What would you say, Annette, to people that are reluctant to get the vaccine?
Oh, I would tell them, it's best to be safe than to be sorry. And I would tell them, what would you rather have? A stomach ache or whether you rather have COVID? If you can do something that can prevent you from having COVID, I think you better try to get that shot so you could save your life, and be able to be around your family because it's really been hectic not being able to be around your family, not being able to do a lot of different things,
Annette, are there anything else that you can think of that you'd like to talk about or share with people?
Oh, no more than just continue to visit your doctors, talk to your doctors, and don't be afraid to ask them different questions and stuff, and continue to wear your mask, even though I've got these 2 shots, I'm still going to wear my mask, Dr. Fair. I'm still going to do whatever I do. And the thing about it is people let their guards down and they shouldn't let their guards down because even after you done took the shots and stuff, yeah, I would tell them just continue to keep your mask on because we still have this virus that's up in the air,
Mhm.
Continue to stay focused, continue to just to keep yourself safe, don't just drop the ball,
Well, I feel much better knowing that you've gotten both shots.
Oh my God,
And
I
it's good
feel
to hear
better.
that you're continuing to mask and
Oh yeah.
well, good. Well, thanks, Annette. I really appreciate your time.
And I appreciate talking with you, Dr. Fair, other than at the doctor's office.
Yeah. Well, you have a great day and I will see you soon. Okay.
You have a great day yourself and God bless you, Dr. Fair.
Same to you. Thanks, Annette.
Okay. Bye-bye.
Good evening, everyone. My name is Julie Olick, and I'm the Community Relations Director at UW Health. And that affords me a really unique perspective on the work that Access has done during the pandemic and certainly before it. So I'd like to share a few of those observations with you this evening and ask you to continue or begin your support for Access. In the early days of COVID-19, we saw that Access immediately responded with new models of care, creating a separate respiratory clinic to what we call cohort patients to keep them separate, staff safe, and other patients safe. That's just one example of innovation that Access implemented immediately and could do so because it is a very nimble organization. Access also adopted telemedicine very early and made that available as an alternative to patients coming for appointments, which of course made it not only safer, but often much more convenient and accessible for patients to receive care and for providers to remain safe. And now that we're in the era of vaccine, you've already heard how our patient Anetta said that her doctor really helped her gain the confidence to get her vaccine. And I know that Access has worked not only with its own patient population, but also with other providers in the community, including community organizations like Centro Hispano and the Mung Institute, to make sure that vaccine is getting into not only arms, but the arms of often people most affected negatively by the virus and by the pandemic. And as we speak of pandemic, we have to acknowledge that we have more than one pandemic going on in this country. We certainly saw in 2020 the pandemic of racism, which came as not a great surprise to many, but certainly has been an awakening for our country and for our organizations. Access serves a population that is about 60% people of color, and about 30% of Access staff identify as people of color. So Access is really at the heart of our community response from a health perspective to this other pandemic. And Access is a very active participant in the work of the Dane County Health Council, as are we at UW Health, as are many of our other sponsors here tonight, ranging from community partners to health providers, all joining together to improve maternal and child health, a critical priority and an area of great disparity in our community. And Access does its work with the help of advisory councils, one English speaking, one Spanish speaking. And it's another way of showing that Access is really part of the community that it serves, and the community is part of it. So those are just some of my observations that I have as a really daily, weekly, monthly collaborator with Access. And so it's with those observations in mind and our whole program in mind that I ask for your support. UW Health does a lot to support Access. We do sponsor this dinner and have for many years. I've been co-chair. I think this is my 20th year. And Janan has more years under her belt than me. But we have multiple agreements ranging from supporting the use of the Epic medical record to having providers in clinic. So we do that. But the other thing I do personally is I write my own check because I also see the difference Access makes. So I really invite all of us this evening. We're in the comfort of our own homes. We may have had our own very challenging years with the pandemic. We may have resources to give. And I would ask all of us to take a moment and reflect on the real difference that Access Community Health Centers makes in terms of medical care, dental care, behavioral health services, and also leadership in community and public health. And consider making a donation tonight. We're not having our usual wonderful silent auction. So you're not going home with an item. You're not picking your flowers up off the table and making a donation. So even what you would have paid to park at Monona Terrace would make a great gift. Please give that some thought. The link is in the chat for you to make a donation. And certainly a donation anytime during the year is welcome. Many of you listening are already regular donors, and for that, we are very thankful. And with that, I will turn the program over to Ken Loving. Thank you.
Good evening. I'm Ken Loving, family physician and CEO at Access. Thank you again for joining us tonight and for your engagement throughout the year. We provided you with regular updates, especially at the beginning of the pandemic, and you answered us with words of encouragement and generous financial support. Of course, tonight we'd rather be together and feel the energy in Exhibition Hall at the Monona Terrace, celebrating with 700 or 800 others who believe wholeheartedly that high quality, affordable, trusted healthcare services are a must for everyone in our community. But we can't gather in that way yet. We will see you in April next year for our 23rd celebration of service. This year, tonight, we are grateful for our virtual connection with each one of you. A special thanks to Janan Yasseri-Mo and Julie Aulick for hosting our event again this year. In their comments, they outlined the heart of the current challenge for Access, and I believe for all of us. How do we move forward as racism persists and the pandemic lingers? As Board President Brenda Gonzalez put it, the health of a community should be judged by the health of its most vulnerable members. Given how communities of color continue to face discrimination and violence and a disproportionate burden from the pandemic, we have work to do to make our community healthier and stronger. Thankfully, over the years, the providers and staff at Access have developed many of the core strengths and systems to address these challenges. Earlier tonight, Dr. Julia Weiser talked about our team-based approach to providing care, and Dr. Kevin Fair and Annetta Price demonstrated how the provider-patient relationship can help both groups thrive, augment vaccination rates, and enable patients to have a say in how Access operates. The pandemic has certainly taken its toll. However, we are now a stronger organization than we were 1 year ago. We have a committed and hardworking staff who've been on the front lines of the pandemic and are devoted to the patients we serve. Our board is diverse, experienced, and actively guiding our work. We've had success as we've advocated for funding and support at both state and federal levels. And we have an informed and generous community of supporters, which includes all of you joining us tonight. Here is what you will see from Access in the year to come. First and foremost, more vaccinations. We are reaching out to patients via text messaging and direct phone calls, and we are vaccinating patients during their scheduled medical appointments. It is immensely satisfying to help a patient decide about the vaccine and be able to vaccinate them right then, right there in the clinic during the appointment. We've hired additional staff who've helped us give almost 3,500 COVID vaccines to our patients. We are not seeing racial or ethnic disparities in our vaccination rates. We've also vaccinated hundreds of people who are providing support to communities of color through local nonprofits, including the Mung Institute, One City Schools, and Centro Hispano. This work will continue. We will help children succeed in school. Prior to the pandemic, we were providing dental care to children in 43 local schools with our mobile dental program, Celebrate Smiles. We are working with MMSD Superintendent Dr. Jenkins and administrators in the Sun Prairie School District to get our program back in the schools safely this fall. We will fight racism. Our anti-racism efforts will encompass staff education, recruitment, employee compensation, and leadership development. We will expand our services to care for more people of color. We will also accelerate our efforts as members of the Dane County Health Council, where we are working to eliminate racial disparities in birth outcomes in Dane County. And finally, we are committed to growing to serve more people. We're now using Epic Wisdom as our electronic dental record software, which will help us expand our dental practice and better integrate our medical and dental services. Our behavioral health team provides us the foundation to improve and expand our substance use disorder treatment services. The opioid epidemic continues and overdoses and deaths are climbing once again. We currently provide medication-assisted treatment to 169 patients, and we will expand those services to help others. We will grow to better meet the demand for our services from people without health insurance. We want everyone in our community to have access to preventive care, COVID testing, vaccinations, and all that our unique healthcare home has to offer. Your consistent support has steadied us during this difficult year and will help us expand our work in the years to come. Together, we are helping our patients succeed in school and in the workplace and at home with their families. We are making our community stronger. Thank you again for joining us tonight, and we will see you in person next year.